Talking about the most common cause of shoulder pain that I see, and this is known as the impingement syndrome. Now, what the impingement syndrome is, come on in here. So this piece of duct tape right here, this is what's called the supraspinatus muscle. So it attaches here and allows the arm to come up like that. Now, when it gets impinged on by the acromia process right here, that is called impingement syndrome. This is normally a very, very strong tendon, but through overuse and getting this pinching, it creates like a guillotine. It starts to kind of fray those fibers, can lead to a partial or what's called a full thickness tear. This would be diagnosed by MRI. You can see a little bit on the diagnostic ultrasound as well. Now, why this happens? First thing that happens is we try and do these big, huge shoulder lifts, and this is after we have an injury, okay? Scapula. What happens is the scapula doesn't move as well as it should. Now, the scapula should normally move up like this. What that allows is it allows the humerus to go underneath there, and then it can move. Okay, so this goes up and then it allows the humerus, kind of unlocks the humerus. What happens is if the scapula is fixed to here and doesn't move, it starts to create this guillotine, especially in this range of motion. So we need to get better scapular mobility. So I'm going to show you some exercises on how you do that. Second thing that happens is you get a overactive deltoid. So since that muscle gets basically trounced upon, the deltoid will overactivate and it'll cause the humerus to suck up in here like that, creating more friction and tearing on that tendon. Okay, so we need to help deactivate that. And then also you get compression of the shoulder capsule itself. So what it does is it creates positive pressure within this, so there's very little blood flow going from the anterior and posterior circumflex humeral artery, so it's not getting blood flow, it's not healing, so we need to decompress that as well. So first thing we need to do is we need to decompress that tendon, and a couple things. First, let's test for this. So if you have pain, you can also have somebody do this. It's called an empty can test. Okay, so you're going to rotate in here like this, and then you're going to pull up like that. And usually this pain is felt right there on the anterior portion of that tendon. Okay, so if you do have pain there, that's one positive sign that can be the impingement syndrome. So here we're going to take this, we're going to get loads and loads of tension, we're just going to step on it, and then we're going to relax this whole entire arm, almost to the point where we're going to try and just drop this humeral head all the way down and out, okay? And we're going to hold this for about 1 to 2 minutes, and we're going to do this multiple times per day. So what this is doing, it's pulling this down, it's creating negative pressure within this joint, and when we create that negative pressure, it sucks up all the blood and the nutrients to help heal this tendon, okay? Second thing we're going to do is we're actually going to inflame the tendon. So we're going to expose this tendon underneath the acromion. So we're going to rotate the shoulder back in like this, and we're going to expose this tendon. And what we're going to do is we're going to do a cross friction massage. You can do this by yourself. So we're going to go in here, we're going to rotate in, it's going to expose the tendon, and then we're going to dig right underneath the acromion where that tendon is, and we're going to do some cross friction. This is going to be, if you have this condition, it's going to be pretty tender, pretty painful. You want to use a good amount of pressure back and forth, and you can do that about 1 to 2 minutes. Now what this is going to do is going to re-inflame that tendon. Almost same concept as like a PRP injection. Re-inflame, re-get those nutrients back there, okay? Third thing, what we're going to work on is scapular mobility. So we're going to rotate this in here like that, and you should be able to reach up pretty high there. Person with bad scapular mobility is going to be like there, okay? We're actually going to use our rack here. I'm going to put that all the way up, and I'm going to get one of my heavier bands, okay? And what I'm going to do is I'm going to reach in, I'm going to grab, I'm going to be up on my tippy toes, then I'm going to come down and really going to open up this, and I can go to the side here, hang down, and it's going to open up my shoulder and get better Scapular mobility. Another thing you can do is basically a wall angel. Keep everything tight to the wall, and then you're going to go up and down through here. Okay, so what we're doing is we are increasing scapular mobility. So decompress, inflame, okay, and this is obviously for healing purposes, and then scapular mobility, okay, and that will help heal your impingement syndrome. Also very important to check mobility of thoracic spine as well. Stay tuned for another video coming up on that. Thanks. We'll see you on the next edition of Talk About It Tuesday.